Good morning. I am Lincoln Chen, President Emeritus of the China Medical Board. It's been a great honor for me to work in Thailand for over the last 15 years, and I'm honored to be a keynote speaker for this conference on Global Interprofessional Education 2022. The theme is how education sector responds to VUCA, health systems. The title of my talk is A New, Better Normal, Health Professional Education for the Future. So I'm going to give about a 15-minute talk with some PowerPoints to illustrate my main speaking points. The conference has 4 sub-themes, including the future direction of health professional education, pedagogy for a challenging future, proactive assessment to enhance learning, and steering health education in a new VUCA world. And your commission is going to have 3 workshops this coming year. In my presentation, I'm going to focus on a series of questions. What is the status of global health professional education? There has been a convergence of long-term trends with the recent COVID disruptions. And what about the pace and nature of recovery? And is there an opportunity for a new, better normal rather than the old normal? So in my presentation, I'm going to start with some longer-term trends and then discuss COVID disruptions, and then how do we begin to think and approach a new, better normal. This is a Lancet commission that was published in 2010 that looked at a century of the Flexner report. And so that gives us a sense of the long-term trend. But last week, my colleagues and I, led by Julio Frank, published another follow-up on challenges and opportunities for educating health professionals after the COVID-19 pandemic. And as you can see, there were 7 co-authors for a Lancet publication came out. It's available online as of the 29th of October. So I'll be presenting data from both of these Lancet commissions. The VUCA is affecting both the health system and the education system quite profoundly. VUCA stands for volatility, uncertainty, complexity, and ambiguity. And obviously in the healthcare system, the system has been overwhelmed with the COVID epidemic, and the education system has similarly been impacted severely by the inability to meet in person in the classroom. Even the labor market for health professionals has been impacted. So every aspect of the healthcare system and the education system has been impacted by the long-term trends and the recent pandemic. The long-term trends in the first Lancet article, we defined as going through 3 generations of Flexner reforms. There was in 1910 a science-based reform putting the training, education in universities. In mid-century, there was innovation in problem-based learning, and then a huge expansion from the classroom into hospitals and academic centers. At the time of our 100-year review, there was a movement toward competency-driven instructional content and health and educational systems thinking and review in the phase that we were going through. What we did was the commission in 2010 concluded that there were severe shortages of workforce, maldistribution, not the greatest mix, very different nurse, doctor, and allied profession ratios, mixed quality, and weak public financing. So we have here this map, this global map that shows the density of nursing at the top and doctors at the bottom by the shades. And you can see Thailand actually as doing as well as China and in India. And this is due to the great tradition of medical education and nursing education in Thailand, launched by Prince Mahidol himself. Now, this is too complicated, and it's something that's in the Lancet, recent Lancet article. If you look to the bottom right, you'll see for the world and doctors and nurses that we have about 11,752 doctors in 2018 and 28,798 nurses in 2018. These have come out of a production system that has around 3,384 medical schools. And we don't have the nursing schools because they're not standardized. There are many different types of nurses. We do have the public health schools there, but we do have the number of doctors and nurses produced. And in 2018, we had 542,000 doctors produced, 1,424,000 nurses, 3 times as many nurses as doctors. Indeed, nurses now constitute 57% of the global health professional workforce. So it is by far the largest cadre of health professionals. Now, there's been a huge expansion, and I won't go into the exact numbers, but basically the medical schools and the nursing schools doubled or tripled over the decades since the first Lancet Commission report. So I think there's been a recognition that we have severe shortages, but the maldistribution, unfortunately, continues. Rich countries and rich regions attracting more professionals than the poor countries and poor regions. We did encourage institutional reforms and instructional reforms. In institutional reforms, we noted the need for accreditation and certification, but also networking and collaboration. Most importantly, financing, so that these things would take place with sufficient financing, public financing. Most of the new medical schools in the world today are from private investments, and often commercially invested. The 3 instructional reforms that we focused on in the 10-year review were competency-based learning, interprofessional-based learning, and internet technology-based learning. And I'll get to those in greater detail later. But what about competencies? We had developed this eye diagram for the competencies. In the middle are the specialized competencies, but it sits on the base of foundational competencies and then more advanced integrative competencies. So different professions or specializations would have the specialized competency, but theories, concepts, and facts which are shared in the scientific community are foundational. And the more sophisticated integrative competencies are critical thinking, numeracy, creativity, emotional intelligence, ethical deliberations, communications, intercultural communications, and teamwork. So these are the skill sets that we believe should be part of the competency-based education. We developed this framework of informative, formative, and transformative learning because we wanted to differentiate the informational aspect from the socialization aspect to the leadership development. That informative learning gives you an expert, but formative socialization creates a professional. And we were arguing that the field desperately needs transformative learning for leadership as change agents. In this more recent Lancet article, we develop a new framework called Education for Life. And that is 3 dimensions. One is learning throughout life, because the knowledge base and technologies change, and learning about healthy lives. So that would be learning through the career about how to provide good health for one's patients. And then as we're learning, given the burnout and the fatigue that the health professionals have experienced, learning how to live healthily your own life. And to do that, you can do the informative, formative, and transformative learning. I won't go into the details of this, but the technology facilitated learning is more easily conducted as informative, but the transformative requires much more hands-on and proactive engagement with the students in the real world. In terms of interprofessional education, that's for teamwork, but the teamwork relates to very different aspects in the healthcare system. There's patient-focused teamwork, where the doctors and nurses and other team members form a team to provide unified care to individual patients. There's population-focused health teams, and those pay attention a lot to the living conditions and the social determinants of health. But there's also teamwork to improve systems performance, which is management and financing and policies. And of course, overall, there is caring for the health of the workforce. We spent quite a bit of time in the second article on organizing a framework for IT-based learning. And we broke that up into 4 different categories that the digital revolution is enabling: knowledge management, pedagogic blend, distance outreach, simulation, artificial intelligence. Knowledge management is really facts and knowledge that can be stored and retrieved instantaneously. So people with a handheld device can easily retrieve information. This reduces the necessity of memorization, but rather puts a premium on analysis and understanding data and being able to use data. Pedagogic blend means that different combinations of in-person and digital learning can be constructed that give you different types of learning, and they will give you different kinds of results also, by the way. Of course, one big advantage of IT-based learning is the distance and outreach. So the IT-based learning can achieve remote access, but the outreach also gives IT access for those that are distant from the source of knowledge and technology. And I think the most rapidly developing aspect of IT-based learning are simulation, artificial intelligence, obviously tying sutures and surgery, but also now increasingly artificial intelligence is making do with pathology reports, radiology, x-rays, and so forth. We don't know the limits of these. We do know that in the pedagogic blend, pure online learning, which has been adopted by many, has not had as good an effect as in-person learning. And in the United States, children who went to online learning are a year behind those who were in classroom or in some kind of blended. One needs to have an engagement of the students with the learning. So we developed this hypothesis that informative learning can be mostly IT-based, but transformative has to be much more proactive and in person, not just with the teacher, but often with the real world. So now I think the question really is, where are we on the crossroads between the long-term trends and the pandemic? And I would go back to the old Chinese saying, crisis or opportunity. I think there's both a crisis right now, the VUCA, but also an opportunity. And the question really is, do we try to return to the old normal or craft a new normal? And under instructional reform, I think we know a lot more about how health systems work. And there are new capabilities, especially with the IT-based learning, but also the necessity of teamwork and competency-based learning. One of the biggest gaps we have, unfortunately, is the lack of standardization of innovations. So when we look through the literature, many individual case studies were reported, but it was not clear which ones of those were effective or not effective. So I think the question would be, which innovation is sustainable, and how do you get political will and financing to back up and learn? Because this field has been characterized by a lack of accumulated knowledge and accepted innovations and standards. And in the journal articles that we looked at, there was very, very little evaluation on effectiveness of any particular innovation. So I would argue that Thailand could take a lead here globally and be the hub of sustainable innovations in combating VUCA. Thank you very much.